Okay, so I have chosen for the teen issues is health risk with alcohol, substance abuse, and tobacco and abuse slash neglect by me. So why I've chosen this is because teens experiment with alcohol and drugs during teen or adolescence is very common, but teenagers often don't see the link between their actions today and the consequences tomorrow. Using alcohol and tobacco at a young age has negative health effects. Stop or con- Teens will continue to stop or continue. Teenagers at risk for developing serious alcohol and drug problems include these. So, with a family history of substance use or just use disorders, who are depressed, who have low self-esteem, and who feel like they don't fit in or out of the mainstream. Solutions we can find is finding counselors, clinicians, therapists. These healthcare professionals are aiming to help individual identify drinking and substance abuse problems and take the steps needed to combat triggers and cravings that can lead to relapse. With child abuse and neglect, ensuring access for all child to be affordable quality healthcare and including parental, dental, and mental health services, increasing efforts to address social problems such as poverty, substance abuse, and family violence, which contributes to neglect. We would want to increase public awareness efforts to educate the public about child neglect, its seriousness, and how they can help prevent it, as well as foster and share a sense of societal responsibility. So where it would be located at the chapter, and it will hold the programs each week there in the building. So funding, raising awareness, so it would be public outreach, media attention. I put with shirts, posters, just about anything, just to be raising the awareness. And I would spend, $5,000 on its funding. Providing mental health counselors, it would be a part-time mental health counselor who will be doing their parental training and alcohol and drug abuse programs, which is going to be offered 3 times a week. And the $8,000 will be paying for that part-time mental health profession. And then the 11,000 will be doing the programs, providing um, funding the programs and making sure that everybody's attending and getting to the program for the help that they need for their risk with alcohol, substances, and tobacco, and for the parentals are for the abuse and neglect. So how long would it be? So I would be running the programs to be all year long and have that support of the mental health person. They're teaching these programs at all times rather than having it in a course of a month, 3 months, a year, 2 years. It'd be constant throughout every year as long as there's funding for these programs.